Hey everyone, welcome back to my channel. It's Scott Winterroth, and if you are new here, I am on a bariatric journey. About a year and 4 months, I had bariatric surgery that changed my life. And in this video, I want to cover off on a bunch of questions people ask me on some of these life-changing topics. Some of you may know, and some may not know, but if you're considering bariatric surgery, you're on your own journey, this is probably a really good video to watch to get to know some of the intricacies of the actual physical changes that you may experience during your process. So here we go.
Was the surgery painful?
Look, this is a major surgery. For me, it was in a hospital. It was a major hospitalization. I was in the hospital overnight, if you will. And yeah, it's surgery. And will you have pain? Yes, of course, you're going to have some pain. In the hospital, I was given some pretty heavy duty painkillers like tramadol and Tylenol 3 with codeine. But after the surgery, I'll be honest with you, I didn't really need it very much. I could regain my strength back right away. I didn't really have a lot of pain to deal with. In fact, I don't think I even really used the painkillers when I got home. Maybe one or two, like the first night, and that was it, really, which is great. I would say yes, you're going to have some pain, but is it the worst pain you ever had? Probably not. I've broken bones and I had other surgeries that were much more painful. I'd say on a scale of 1 to 10, it's like a 6.5, if you will. It's really not that bad. So yes, you will have pain from the surgery, and you might have pains eating too, but that's another conversation I'll have a little bit later in this video.
What about constipation?
Most likely, yes, you'll have constipation because you were on a liquid, high protein diet for a week, and then you have this surgery. Literally, your whole system has to restart and everything gets stuck in there, if you will. The doctor, I know for me, prescribed a prescription strength laxative. I actually didn't really use it that much. I just had what I would consider normal grade constipation. But that's why you're supposed to drink a lot of water. That's why you're supposed to keep yourself pretty clear in that aspect. Also, you have to remember too that you don't really eat anything. So you don't really have any fiber in your diet. So that is something that can lead to constipation. The medication they give you're taking, like that can lead to constipation. So yes, you will have some constipation. It's not forever, but it's something that is more likely to happen between the first few months after the surgery and up into 6 months or so until you start to get to more normal foods in your diet. So expect to be a little backed up during the process.
When can I return to work?
This is a question, obviously, that varies per person. There's different reasons this can change. I know for most common surgeries, like the gastric sleeve as well as the gastric bypass, it's typically a 2-week window they want you to stay. I know for me, I could have probably returned to work within a few days. But I had a whole bunch of vacation time, so I decided just to take the whole 2 weeks at the time, and I was going to lose that vacation time at the end of the year. So I decided just to take it. But I will say, I know, I thought I was going to be bedridden and stuff like that. I was not. I was pretty active. I think if you have a desk job or a remote job, you probably could do it within the week for sure. But of course, you want to be careful. Your body is recovering from major surgery, and you want to make sure that you have a little bit of a runway in case something bad were to happen. So that's probably more the reason why they asked for 2 weeks. But if all goes as planned, which I hope it does for you if you're considering it, then I would say give yourself a good week for sure. Maybe after the second week, you can return to some normal activities. But I know for me, I felt so good that I decided to take a 6-hour road trip. So probably wasn't supposed to, but I did make sure I got out every hour and a half to walk around and make sure that I didn't have any blood clots brewing or anything like that. Yes, I think you'd be okay. It depends, obviously, your tolerance to pain and your typical recovery time and things, but I think returning to work, I would give yourself 2 weeks, but really a week for sure.
How many doctor visits did you have?
Okay, this is a really good question. Before the surgery, I had a whole bunch of doctor's appointments between psychiatric appointments and dietitian appointments and actual surgeon appointments, as well as following up with my normal doctor to get approval letters and stuff like that. So I would say there were 6 different doctor's appointments before the surgery during the approval process. And then of course, the day of, the pre-surgery clearance and stuff like that happens pretty quickly. And depending on your system, you may have to go to separate doctors for that or not. So after the surgery, of course, you have the hospital stay. And then I think I had a 3-month follow-up and then a 6-month follow-up and then a 1-year follow-up for me. And each time, each one of those follow-ups was a follow-up with the surgeon as well as a follow-up with the dietitian. Those are, in my world, those are 2 different copays, if you will. But ultimately, it all works out in the very end, and it was pretty clear. They're all pretty simple follow-ups. I know for me, meeting with a surgeon was just a touch base to make sure everything's okay, no major problems, take your blood work, Make sure you're not vitamin deficient in any way because that is something that can happen with this surgery. So you want to make sure you're taking all your multiple vitamins and all of your calcium supplements and stuff like that, as well as protein. And then the dietitian is obviously giving you ideas for what you can eat during this phase of your journey. Meeting with the dietitian, actually, I thought was interesting and I enjoyed meeting with the dietitian. The surgeon, I felt was a little bit extra. It's probably good to touch base with them, but also it was a waste of time in some ways. I also have my annual physical too. So one thing I learned is that I'm trying to schedule my annual physical with my primary care doctor in 6-month increments to my annual check-in with the surgeon. So it's not right on top of each other. That way if they take blood work, it's a little bit more of a window versus doing it too short or too long. So something to consider after you have the surgery and after you're into 1 year follow-ups. Life in general, this is a really good question.
When did you feel normal again?
Okay, so first of all, life will never be normal again in terms of how you eat. That's something you should consider now. Now, it doesn't mean you can't get to normal foods, but if you want to live a healthier lifestyle, you want to live the bariatric lifestyle, then you probably will have to change what you've been eating for the last however many years you were alive, right? That's something you have to consider. If you are investing in this journey, then you likely are changing your diet from here on out. Now, that being said, doesn't mean you can't enjoy certain things. Actually, yesterday was Thanksgiving, and I had a pretty normal Thanksgiving meal. Maybe not as much as I would have ate before the surgery, but I had a little bit of everything. The only thing that was really missing from my plate was anything with sugar because I don't like eating sugar. Now, that's both a preference as well as something that's a byproduct of the surgery, but I'll get into that more into another video. But basically, I mean, I had turkey, I had ham, even had some bread and carbs. And remember, it's just one meal. This is one meal. It's not going to derail your entire diet because you had one Thanksgiving dinner. So that's one thing to keep in mind. Obviously, I maybe didn't eat as much. And yeah, I actually did feel like the bypass kick in after I ate a little bit. I had to slow down. One thing that probably you can do, like you will learn to do is slow down for sure. I've always been a very super fast eater. This is something that has changed drastically since I started with gastric bypasses. I definitely eat much slower because you have to make sure your body has enough time to get food into your gut because you don't have that reservoir stomach that you had before. Now, in terms of getting back to normal, one, as I mentioned, recovery time is pretty quick. I think I was back to normal within 2 weeks. Really, from like 2 weeks to like 6 months, it's like the rapid weight loss period. So this is really where things get a little weird because you're losing weight so quickly. This is where buying clothes is weird because you're not really sure when to buy clothes or where to buy clothes. And like, do you buy what size? Do you buy lower or higher? That really happens within the first 6 months or so, 6 to 9 months. It depends on how far you want to go, how much weight you want to lose, of course. But ultimately for me, I have like 2 major points. Like I lost like maybe 60, 70 pounds. And then then I was like, okay, I need to really amp it up. And that's when I went to the gym and was doing it more on my own. So that's when I got back down to my goal weight and more towards 110, 120 pounds. Then in terms of normalcy, like eating wise, I really started to eat more normal 6 to 9 months into it. Now today, I basically can eat what I want, but of course I have this surgery. So it's going to slow me down as a tool to make sure I don't overeat. But also I had to be careful because obviously I can eat more of what I want. Yes, I do have some pizza now and then. Not maybe as much as I had back in the day, but I realized that I can have a little bit, but of course, exercise with eating less is going to help me maintain my weight and maintain my new physique. So it's something I want to keep in mind. So getting back to normal will take a little bit eating wise. Clothing wise, that obviously depends on how aggressive you want to be with your weight loss. I would say 9 months or so, you're going to be, for me, it was about 9 months to get into a point where I didn't have to buy downsizes so much. Of course, I'm at the point now where I probably could still lose 20 pounds and still be considered overweight, actually, by medical terminology. But I don't really want to lose a ton of weight right this second. I'm happy where I'm at. I don't really want to buy any more clothes, if you will. So I think for me, 13 months in or so, 13, 14, 15 months in, I'm happy with where I'm at. So I want to stay at this weight for right now. So that's some normalcies. I think that these are some subcategories that I want to cover.
When can I start being intimate again?
Obviously, I'm married and my wife, and I think for me, like there's really no waiting period after the surgery. For women, it may be a little longer, so definitely check with your doctor about when that may be an option for you. It is a surgery that's in the lower part of your body, so you don't want to mess anything up while you're in that process. It's more like exercise. Obviously, intimacy can be pretty strenuous, so you wouldn't want to hurt yourself after a surgery. I know for me, I wasn't cleared for full exercise until the 3-month check-in.
When can you get pregnant?
Now, this obviously again is a big difference between men and women on this. That for men, as soon as you're able to resume intimacy, obviously building a family is not really an issue after bariatric surgery. For women, I have heard that it's like up to 2 years before they clear you for pregnancy because they are actually watching your vitamins and stuff like that. You want to be as healthy as you can be. Obviously, if you're expecting pregnancy, can be a while before you can get to that. So definitely consider that if you're thinking about getting bariatric surgery, and check with your doctor on how that could how this surgery could have implications for you if you're considering getting pregnant.
What about vice stuff like smoking, alcohol, and plastic straws?
Using straws, believe it or not, like this is something that is a bariatric thing. You're not really supposed to use straws after you have bariatric surgery, and I don't really know why. No one told me out of my actual dietitian and doctor that I could use a straw. I use straws every day now, and nothing's ever bothered me. So take it as you will. Use a straw if you want or not, but you're not really supposed to use them. Alcohol, I will have a drink every now and then. I do feel that I get drunker faster because it goes right in my gut kind of thing, but alcohol you can have in moderation. But keep in mind, most alcohols have sugar in them, so that's something you have to be careful with dumping syndrome. Also, there are like some statistics that bariatric surgery can actually enhance your susceptibility to alcoholism. So that's another reason why I tend to stay away from alcohol. Smoking, you probably shouldn't do anyways. So I don't think any medical professional can tell you it's okay to smoke. But I'm guessing if I decide to have a cigar with the buddies once a year, it would be fine. Should you make it a habit? Probably not, because smoking is bad for you. So why would you do that anyways?
Any last advice?
Just be sure to follow your prescribed diet, and it's going to be amazing. You'll go through rapid weight loss and you'll get down your goals. Being overweight, especially morbidly overweight, is super hard to lose weight once you get over like a certain sort of threshold. So bariatric surgery was an excellent opportunity for me to get where I want to be weight-wise, and it let me regain control of my body, which I highly recommend if you're struggling with weight loss, you're struggling with your mental feeling of how you feel about yourself. I think this is a really good opportunity to get to where you want to be and just feel amazing again. And really, life kind of returns to normal at some point. I think a lot of people think when you have bariatric surgery, it's like almost like a death sentence to what you can eat. In some ways, that may be true, but in a lot of ways, it's not. Of course, if you want to maintain your weight, you want to maintain your physique, then you probably are, yes, you're going to be eating different than what you were when you were overweight with the overweight mentality. But that being said, you can still eat things in the future that will make you feel more normal in the long run. You have to do everything in moderation. It's not a death sentence to the fat lifestyle, but ultimately, I think it's definitely something that will help you maintain the best version of yourself. And if you like the type of content, you want to be inspired by my journey, then please like and subscribe and stay tuned for more empowerment content to make you live the best life for yourself and help me maintain my weight and stay motivated. So thanks for watching. That's it for this video.